Let's talk about what are the various imaging studies we do to help us diagnose the COVID-19 infection. These will aid us along with the laboratory tests which we are going to do. So what are the various important imaging studies? As the symptoms are generally the respiratory tract symptoms, so chest CT has become a gold standard for the diagnosis of the COVID-19 infection. And there are certain classical features of the chest CT which have been found consistently in a lot of patient population who have then eventually been found to be COVID-19. They generally are the features of the developing AIDS or full-blown developing acute respiratory distress syndrome. So what are those chest CT abnormalities? The most commonly found abnormalities in patients who have had symptomatic disease or patients who have a documented infection have been the bilateral chest abnormality. It is basically the similar presentation of someone presenting with an atypical pneumonia, but in these patients, specifically if they are developing AIDS, the disease severity and the abnormalities are a bit severe. So the chest CT is generally found to have a bilateral abnormalities with the peripheral distribution of the abnormalities. You can see the peripheral opacities of this disease. And in certain patients, the disease has been found to be predominantly involving the lower lobes bilaterally. And in certain types of the patient population, we have also noticed the peripheral pleural thickening, which shows that the pleura might also be involved. So these chest CT abnormalities have been the most common. They have mostly been bilateral chest CT abnormalities with the peripheral distribution involving the lower lobes, and in certain population we can also find out pleural thickening in these patients. Certain rare abnormalities which are found on the chest CT have been pleural effusion in certain patients. This can also be bilateral. And then in certain population we have also found out certain types of lymphadenopathy. So chest CT is basically the gold standard. We perform it to raise the suspicion of the disease if someone is having clinical features or someone who is exposed to these, to someone having COVID-19 infection. And then what are the important abnormalities to look for in the chest CT are the peripheral distribution bilaterally, generally of the lower lobes, and also involving the pleura or the pleural thickening.